Hello and welcome. Today we'll talk about one of my favorite subjects, financial support for HBCUs. And we'll talk about an incredible opportunity in a new partnership between Sutter Health and Charles Drew University that I believe will have a lasting impact on HBCUs as well as create positive health outcomes for all Americans. Leon Clark, Chief Academic Affairs Officer at Sutter Health, and Dr. Deborah Prothrow-Stith, Dean and Professor of Medicine at Charles Drew University, are joining us to have that conversation and give some insight into this collaboration. Mr. Clark, can you tell us about this exciting new partnership between Sutter Health and Charles Drew University?
Thank you, Angela. I'm glad to be with you. I view this as a partnership between two organizations that are both committed to social justice and both committed to addressing issues of health equity that's affecting our communities and has for a long period of time. The partnership is really based on three different components. The first is growing the capacity of the CDU Medical School. We'll do that first by providing full tuition scholarships for 25 of their students, 5 a year for the next 5 years, or 25 students over a 10-year period get to go to medical school, tuition-free. And we think that is a big deal, but the first step of many steps that are necessary in order for us to deal with two of the main challenges in healthcare. One is access to high quality healthcare, and the second being health disparities that disproportionately affect communities of color. And so that's that's one element of it. The second element is an alliance for health equity research and evaluation, again, focused on understanding the underlying factors that contribute to inequitable outcomes impacting both of our communities. And so we're excited about what we can do together. We hope that this Health Equity Alliance will be a model for other institutions to follow. This is a matter of importance that I think takes all of us committed to healthcare, committed to social justice, working together to address. The last part is a partnership around the residency programs of both institutions. The data is clear that racial concordant care really matters in the context of outcomes. Mm-hmm. And if you think about the diversity of California, where 45% of the population is Latino or Black, and when you consider that only about 10% of the physicians in California are Latino and Black, we have a gap that needs to be addressed with alacrity, in my view. Our organization's coming together, bringing 150 years of combined experience, working together to meet this need, not only for today, but for the future, I think is really exciting. And we're really excited to get started.
Dr. Prothrow-Stith, how is this partnership going to affect the future of Charles Drew University?
I think the partnership is exciting for all three of the components that were listed. In fact, the scholarships for our students is probably the most immediate impact, and for the students, the most exciting, because it means that they will graduate tuition free and debt free when it comes to tuition. And I think that is just a huge advantage when it comes to selecting where you want to practice, giving back to the communities. Our students come from under-resourced communities. They are Black and brown, and they reflect what American medicine needs, what California needs in order to provide high quality, authentic care to Black and brown people in the state. And it's really not just the impact on the patients that they will serve, but it's the impact on the system, making the healthcare system more authentic and higher quality and experiential in its offering to patients. So we're just super excited about the students in our class. The research aspect, while it seems a little more distal, it is very exciting for CDU faculty and students. We have a robust research environment here, and Sutter is just an amazing partner to look at issues of disparities. The work that will come out of that will just be will contribute for really decades to come. The clinical opportunities for our students are extremely important for us, as we're a community medical school, which means that we have to affiliate with multiple hospitals and healthcare systems in order to get the adequate training for our students. So this partnership will continue to give. It is already giving and exciting as we recruit the Sutter Scholars for the class of 2028. And of course, our inaugural class, we have a new medical school here in South Los Angeles. Our inaugural class is matriculating now. We're recruiting our second class, and they're like, oh, well, what about us? What about us? We're like, okay, we got you, we'll figure it out. But this is one of the most exciting things that has happened since we opened a new medical school.
That's great. And I'm sure those students are excited about getting those scholarships. Also, a little bit about the history of Charles Drew University. There may be some people watching who aren't that familiar with your university, maybe on the East Coast. Can you tell them a little bit about the impressive history of your university?
Sure. Charles R. Drew University of Medicine and Science is 57 years old. Founded right after the Watts Revolt, and specifically around issues of healthcare. We were initially founded as graduate medical education residency programs for the new county hospital that was also started about the same time. And we've grown over the years to have a nursing school, a college with several master's programs, master's in public health, master's in biomedical sciences, and our College of Medicine, which has a new MD program. Now, for 40 years, we've worked with UCLA in a partnership where we help to train students who were really UCLA students. We claimed them as our own. They claim Charles Drew, but from the accreditor's perspective, they were UCLA students getting UCLA degrees. So now we have our own independent MD program, and in 2027 we'll graduate our first class of medical students that will receive a Charles R. Drew University of Medicine and Science MD degree. So we're very excited. I sometimes think about the fact that Boston, where I spent a lot of time, has 700,000 people and 3 medical schools in Boston proper. South Los Angeles, the area that we serve, has 1 million people and we now have one medical school. So this is really for this community the fulfillment of a 57-year-old dream. And having Sutter Health as a partner just validates and secures that dream in ways that are really, really important.
Mr. Clark, how would you measure the success of this partnership?
I would say success looks like a number of different things. One, that we have the opportunity to attract 25 diverse physicians to our communities, serving the patients who essentially need their support the most. So that would be one aspect of it. To the dean's point, the research collaboration and alliance is really exciting to us. What we do in research is we generate new knowledge. And what we know about knowledge is that knowledge is portable. It could be shared and applied anywhere across California, across the country for that matter. And what we know is that issues of health disparity not only affects us here in California, it is a national, international problem. And so we hope that what we do would be a force multiplier across the country. And then perhaps the third thing is inspiration, aspiration. We'll learn from one another, but we're also going to be teaching one another and serving as a model for other organizations who hopefully will do their part in partnering with organizations like Charles Drew, like Morehouse School of Medicine, like Howard, like Meharry, because we need that partnership. And we need to do it in a way that ultimately results in more diverse students and doctors for the diverse populations across the country who for too long have been underserved.
We really appreciate this partnership between Sutter Health and Charles Drew University. And I feel that supporting HBCUs is something that we all should do in all communities because HBCUs are such a cornerstone of this country. I also feel like if we can find partnerships for every medical school at HBCUs, that would be amazing. So this is the perfect example of what other institutions can do. Leon Clark, Chief Academic Affairs Officer at Sutter Health, and Dr. Deborah Prothrow-Stith, Dean and Professor of Medicine at Charles Drew University. We really appreciate you being with us. And if you have any final thoughts, please feel free to share them now.
I want to thank you for the opportunity to join you today, and thank you for the work you're doing and will continue to do. Deb, it's such a pleasure. It's always a pleasure to see you. We'll be together. We'll be together next week. We look forward to that and really getting us off the ground. If I could maybe express a hope, and that hope would be that all of the medical schools mentioned as part of this will start to come together and work together. We have common interests. We have common challenges in our communities. I think of maternal mortality and how much impact we could have if we just simply work together. And so that's I'll leave you with that sort of hope and aspiration. And we do hope with your help and the help of many others that we'll find ways to come together in a meaningful way.
I would just add my thank you as well and let you know that the 4 HBCU medical schools do work together on a number of things, including a wonderful HIV prevention project in Zambia, where we're all 4 involved, and very, very much local domestic projects as well. So we will look forward to even more Sutter funding to bring us together. Or, Common Spirit as a very big partnership with Morehouse Medical School, another way that we could all look to come together.
That's right.
I think we're all looking forward to that.
Many thanks.